Hello, everybody, and welcome to another episode of Mental Architecture, Building the Mind One Moment at a Time, based off the book by the same name. I'm Howard Blumenfeld, and I'm the author of the book, and I'm happy to bring you another video that is intended to be a chapter section summary, but also kind of goes into a little more detail than that. Today, we're going to be talking about advancements in mental health awareness. And if you think about mental health, there's never been a time more important than now during the coronavirus pandemic, where people need to take stock of their mental well-being. Over the past few centuries, what mental health has really changed from not just century to century, but even in some cases from decade to decade, and in some other cases more recently from year to year. Defining what is exactly sound mental health is not an easy task, but psychologists and psychiatrists alike rely on the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5, to make their diagnoses and to come up with their treatment plans. But the kind of one-dimensional way in which mental health disorders have been looked at over the years has been changing recently, as well as the therapy and treatment. So most recently, we've seen cognitive science, machine learning, cognitive neuroscience, and psychology all kind of intersecting together to come up with new techniques and new technologies to really help people out who suffer from mental health conditions or just mental health issues, more transient issues. And I think that as the years progress, we're going to see much better and more efficient developments that will be more helpful to people than what we've seen in the past. So I'd like to read a quote to you to start things off. Right now, the biggest use of virtual reality in clinical settings is probably in the area of exposure therapy, and that's probably because the technology is well matched to the needs of the clinical application. We see with exposure therapy, the goal really is about helping the patient, whether it's due to a simple phobia or PTSD, to engage, to confront, and to process difficult traumatic memories, by Albert Rizzo. The most effective therapies is cognitive behavioral therapy, and that's where a therapist sits down with you and tries to get you to modify your behaviors through a greater understanding of what's causing them, as well as using different techniques to kind of practice to change those behaviors. With virtual reality therapy, you can take the best of cognitive behavioral therapy and also biofeedback and kind of combine those together and get a new kind of therapy where the patient puts on virtual reality lenses and they can be exposed to their greatest fear. We know exposure therapy works most of the time with fear of snakes, fear of spiders, those kinds of things. But imagine you had a fear of heights and you could just put on some goggles and you could suddenly be on top of a really tall building and you can get all those sensations. I think therapy like that could be very helpful in addition to the existing methods. So it's just improving what's already been done and helping people to overcome their fears in a way that is less invasive than actually going to a skyscraper and standing up there. What virtual reality therapy does is the patient knows or the client knows that they're not actually in any kind of imminent danger. So it gives them kind of a graduated way to overcome those fears. And I think we're seeing the development of therapies. If you think back to an earlier video, I talked about time perspective therapy. But we're seeing the development of therapies that are a lot more adaptable and in some ways a lot safer than older ones. Like if you were afraid of spiders or afraid of snakes, like I was saying earlier, and you could actually experience that with augmented reality or virtual reality, where you don't have to be around those objects or around those animals or insects, you could actually get over those fears a lot easier, I think, for sure. And you can practice these techniques at home and not just in the clinical setting. So in addition to virtual reality therapy, we kind of want to take a step back and look at the broader picture. Over the past century or so, clinicians and researchers have relied on statistical data and also clinical practice to come up with definitions of mental disorders and also the associated treatments. But using those methods is unreliable. There's statistical outliers, and there's also broad categories, too broad or too narrow categorizations that can really get in the way of making an accurate diagnosis. if you take what's been happening recently with this huge artificial intelligence boom, machine learning boom, we can feed computers scores and scores of data, and they can analyze that data and use it idealistically to help treat a patient complaining of clinical symptoms. Again, this is not going to be a replacement for clinical psychotherapy or clinical psychiatry, but it is going to certainly help as a useful adjunct, because maybe instead of relying on individual revisions of these huge books of mental disorders and personality disorders, instead of that, how about we have an evolving and fluid system where machine learning can utilize humongous amounts of data and help mental health disorders kind of adapt along with that, so that maybe instead of thinking of a disorder as clinical depression, we could see a huge spectrum of clinical depression. And that's kind of the direction that things have been heading in anyway. If you think about autism, many years ago, autism was considered to be something completely separate from Asperger's. Or if you think about schizophrenia, there was a very rigid definition of schizophrenia, and then you had schizotypal personality and that kind of thing. Well, in modern diagnostics, they look at these disorders as existing on a continuum or on a spectrum, where you have very, you have like with schizophrenia, you have very high levels of psychotic symptoms on one end, very low levels on another end, and you have different kinds of dimensions that all come together to form the bigger picture of the patient. And so I'd like to read another quote to you to kind of explain in a more general sense what I'm trying to get at here. But even as walls between conditions were being cemented in profession's manual, most patients turn up with a mix of symptoms and so are frequently diagnosed with several disorders or comorbidities. David Adam. And the manual he's referring to is the DSM. So I feel like it's really important to keep the fields of psychology and psychiatry ever evolving and really challenge a lot of the old ideas. One of the things that happened in the revision of the latest DSM was that the waiting period to treat grief-related depression was taken away from the 2-month period that used to be there. So people who had depression related to grief would have, before they could really be diagnosed with having that condition in a way that they needed treatment, they would need a 2-month waiting period according to the DSM. That has been changed. And like I said earlier, they're starting to view disorders as existing on a spectrum, so that the treatments are more adaptable to the individuals. And some disorders kind of cross over and overlap. I mean, I think the difficulty with psychiatry and psychology is that the human brain is highly complex. And while there are certain neurotransmitter and other chemical imbalances that can throw the brain out of whack in kind of predictable ways, there are also the fact that every brain is slightly different, and the way that certain brains react to different stimulus, there's different stimuli and different medications and different environments, is very variable. So you have to kind of keep that in mind, that the way one person experiences depression may be entirely different than the way another person does. In some individuals, depression is temporary and transient. In other individuals, it is clinical, it is neurologically based. And I feel like with machine learning and improvements in the way that we analyze statistical data, we can see improved treatments for these people. So ultimately, the goal is to keep moving forward with psychotherapy, keep moving forward with addressing mental health conditions and trying to describe them more accurately, and instead of approaching them in these broad categorizations, move towards a spectrum-based diagnosis, and also, at the end of the day, treat the person like an individual and realize that you can't just fit a bunch of people into one box and treat them all the same way. I think we saw that with autism, which has become autism spectrum. We've seen it with depression, and depression has definitely been kind of blown open in the most recent DSM, and even with schizophrenia and other disorders too. So going back to the main theme of this chapter, no normal, I think we can see that even with mental health conditions, there really is no normal acceptable definition for any one person. I know that there are clinicians that don't even like to reveal their diagnosis to their patients because they don't want them to get wrapped up in it unless it's absolutely necessary. I'm talking probably more here about personality disorders and that kind of stuff. So we just got to keep moving forward and keep making these kind of improvements, and hopefully people will start to get the treatments that they need. So in next week's video, I want to talk about the positive features of mental illness. When we hear mental illness, I think a lot of people automatically think about negative things, but there actually is a link between people who have mental illness and who have high levels of creativity, and the two may go hand in hand. And so next week, I want to look at some scientific studies that were done to establish that association. Thank you for joining me this week for another episode of Mental Architecture. Please like, comment, and subscribe. Click the ring the bell to be notified of future videos. And I look forward to seeing everybody next time. Thank you. Have a great day.